You might think your double chin is just weight gain, but 40% of people with normal body weight still have one.
Hello, I'm Dr. Davidson. For the better part of 30 years, I've been a heart surgeon and an emergency medicine physician. I've literally seen the human body from the inside out. And I'm 55 years old myself, and believe me, I've had that moment. We all have, right? You're in the bathroom, the light hits you just wrong, and bam, you see it. The jowls starting to drop, that jawline softening into what everyone dreads, the turkey neck. Well, today, we're going to go through the actual, clinical, evidence-based way to fix it. Okay, first things first, let's just cut through all the noise you see online. You've got these fitness influencers telling you to chew on rubber balls. I mean, seriously, or to do endless face yoga. Look, as a surgeon, I need to be crystal clear about this. It is physiologically impossible to spot reduce face fat by chewing. It just doesn't work. The muscles in your jaw are tiny. They can't burn enough calories to make a dent. The real problem isn't some fat you can just burn away. It's a deep structural collapse. And that is something we can actually fix.
So, before we can even think about solutions, we have to properly diagnose the problem. Why does this happen to pretty much everyone as we get older? Well, it all comes down to the simple mechanics of your neck's anatomy.
I want you to think of your neck and jawline as having a kind of biological scaffolding. It's made of this amazing stuff called fascia. It's a connective tissue that literally holds your skin and muscles up right where they're supposed to be. You've got one layer right under the skin and a deeper layer wrapped around the muscles. Now, as we age, gravity is just relentless. But here's the key. The problem isn't that the scaffolding is permanently broken or stretched out, it's just deactivated. And the good news is we can turn it back on. Now, what's really fascinating and frankly a little scary is how our modern lives are making this collapse happen so much faster. Get this, 40% of people who are at a perfectly normal body weight still have a double chin. So why is that? Well, it usually comes down to one thing, tech neck. See, for every single inch your head juts forward, you're adding another 10 pounds of force to your neck. So when you're looking down at your phone, you could be putting 60 pounds of pressure on your cervical spine. That is like having an 8-year-old kid sitting on your neck all day long. It physically shoves everything forward and just completely deactivates the very muscles designed to hold it all up and tight. And this right here shows you just how incredibly powerful posture is. This isn't just a theory. A 2021 study showed that just by correcting head posture, people improve their neck angle from about 48 degrees to nearly 70 degrees. That change alone can visibly tighten up your entire jawline almost in an instant. In fact, some studies show you can reduce the appearance of a double chin by up to 50% in just 6 weeks, just by fixing your posture. That's it. If you want a little preview of your neck's true potential, I want you to try this with me right now. Go ahead. Look in a mirror or just put your hand on your neck and swallow. Feel that? For just that 1 second, everything pulls up, everything gets tight, and your jawline gets defined. That happens because swallowing forces all those muscles under your chin to contract. Our entire goal here, with everything we're about to do, is to train those muscles to hold that tight, lifted position all the time, naturally. Okay, so now that we know why this is happening, let's get to the good stuff, how to fix it. We're going to dive right into the first part of the treatment plan, using a few very specific, clinically proven exercises to wake up those sleeping muscles. All right, our first exercise is what I call a clinical reset for your posture. It's the simple chin tuck. Let's walk through it. I want you to sit up nice and straight. Get your back right up against a chair. Now pick a spot on the wall directly at eye level and just stare at it. Here's the most important part. Without tilting your head at all, just slide your head straight backward. It's like you're trying to give yourself a double chin on purpose. You should feel a really good stretch right at the base of your skull. Hold it there for 5 seconds, then relax. Do that about 10 to 15 times for 3 sets.
Now for the main event. This is our primary muscle builder. It's called the Chin Tuck Against Resistance, or CTAR for short. And this isn't just something I made up. A huge systematic review in 2023 confirmed that this exercise activates those deep neck muscles better than anything else. So grab a little ball or even just a rolled up towel, stick it under your chin, and then push down into it with everything you've got, maximum force. I really want you to feel those muscles firing. Hold that squeeze for a whole minute. Then, on your very last set, I want you to finish with 30 quick, fast pulses to completely burn out the muscle. That's how we force it to get stronger.
Now, we can't forget about that big, sheet-like muscle that's really responsible for the turkey neck look. It's called the platysma. And here's the secret to it. It's made of fast-twitch fibers. That means it doesn't respond to slow, long holds. It responds to quick, explosive movements. So to turn it on, try this. Tilt your head back, look at the ceiling, and make a big kissing or puckering motion, like you're trying to kiss the sky. Do about 10-15 of those. You can also make really exaggerated O and EE sounds to fire up the muscles along the jaw. Yeah, you're gonna feel a little silly doing it, but trust me, it absolutely works.
Perfect. We've covered the mechanical side of things. But listen, the structure is only half the battle. Now we need to look inside at the internal factors that create that puffiness and softness around the jawline. We're talking about what you eat, what you drink, and even how you breathe.
You know, in my practice, I've found that what most people think is stubborn face fat, well, it isn't fat at all. It's actually anywhere from 2 to 5 pounds of trapped water and lymph fluid. I call it fake hydration. It happens when you drink tons of water that's been stripped of its minerals, while also eating a high-sodium diet. Your body freaks out and just holds on to all that fluid to try and balance things. The fix? It's surprisingly easy. Switch to a good spring water, or just add a tiny pinch of high-quality sea salt back into your filtered water to give it those electrolytes. A tablespoon of apple cider vinegar and some water first thing in the morning can also really help flush everything out.
Okay, this next one might really, truly shock you. The way you breathe can literally change the shape of your face. When you're a chronic mouth breather, especially at night, your jaw and tongue muscles go slack. They collapse. This pulls your neck forward and dries out that all-important fascial scaffolding. Over time, it can even lead to a condition orthodontists call long face syndrome. Nasal breathing, on the other hand, is a game changer. It actually boosts nitric oxide, which helps tone the muscles in your neck. I know it sounds weird, but I strongly suggest you try mouth taping at night. Just a little piece of gentle porous tape. The results can be absolutely incredible. So when all those neck muscles are tight from bad posture, that lymph fluid we talked about gets stuck, and that creates puffiness under the chin. But you can manually drain it. The key is to use very light pressure. First, you gently sweep from the center of your chin outwards up towards your ears. But here's the crucial part that everybody misses. You can't just stop there. You then have to sweep all that fluid down the side of your neck all the way to your collarbone. That's where your lymph nodes are waiting to process it all. Just do this for 2 or 3 minutes every morning.
Now, if you do have some actual fat deposits under your chin, that's often a sign of an insulin problem, because those specific fat cells are packed with insulin receptors. The single best way to lower your insulin is through fasting. Even a simple 18-6 intermittent schedule makes a huge difference. But look at this. A 24-hour fast can spike your human growth hormone, which is the ultimate hormone for anti-aging and skin tightening, by an absolutely staggering 2,000% in men and 1,300% in women. That is your body's own built-in skin tightening serum. It's incredible.
All right, now, for those of you who want to kick things up a notch, or maybe you have a bit more skin laxity to deal with, we can get into the gold standard topical treatments and non-surgical options that you'd find in a clinical setting.
So get this, we lose about 1% of our collagen every single year after we turn 25. And for women, that number can jump to a shocking 30% in just the first 5 years after menopause. To fight back, there are 2 ingredients that are king for the neck. Retinol is fantastic. It helps thicken the dermis and build collagen, but, and this is important, use an over-the-counter strength. The skin on your neck is too delicate for prescription stuff. The other powerhouse is peptides. They work a little differently. They basically send signals to your cells telling them to build more collagen, and they're way less irritating.
One of my absolute favorite at-home tools is red light therapy. Here's how it works in simple terms. Think of it like a battery charger for your skin cells. The light penetrates your skin and stimulates the mitochondria, the little power plants in your cells, to produce more energy, or ATP. With more energy, they can get to work repairing things. The science shows that if you use a device with the right wavelength, around 670 nanometers, for 15 or 20 minutes a few times a week, you can see a significant jump in collagen and elastin in just a couple of months.
Now, if you're looking for the heavy hitters in the clinic, the non-surgical gold standard right now is radiofrequency microneedling. You might have heard of Morpheus 8. It uses a combination of tiny needles and heat energy to trigger this massive collagen rebuilding response from deep within the skin. Then, for very specific little pockets of fat, we have Kybella injections. It's an acid that literally melts those fat cells away for good. Just remember, Kybella gets rid of fat. It does not tighten the skin on top of it.
And there's another really clever little trick called the Nefertiti lift. It's brilliant. We do tiny injections of Botox into those vertical bands you sometimes see in the neck, the platysmal bands. What this does is it relaxes the muscles that are constantly pulling your jawline down. So by shutting off the downward pull, you allow the upward pulling muscles in your face to win the tug of war. The result is this beautiful, subtle, natural lift that lasts about 3 or 4 months.
Okay, wow. That was a lot of information, I know. So let's bring it all home. Let's consolidate everything into what I'm calling the doctor's orders. A simple, actionable plan you can start using today to see real, visible changes in just the next 2 weeks.
But first, a little dose of reality, a hard truth. We have to be realistic here. If you are carrying significant excess body weight, you typically need to lose around 8 or 9 pounds before you'll really see those changes show up in your face. And for most men, to get that really sharp, chiseled jawline, that usually means getting down to about 10 to 15% body fat. I'm not telling you this to discourage you, but to empower you with the whole story. So, here it is, your 14-day Kickstart protocol. 5 simple steps. Step 1. Just be mindful of your posture all day long. Think ears over shoulders. Step 2. Do 1 session of those resisted chin tucks every single day. Step 3. Tonight, give mouth taping a try. See what happens. Step 4. Every morning when you wake up, do your 2-minute lymphatic drainage massage. And Step 5. Start a clean, intermittent fasting schedule to get that insulin down and that HG up. That's your prescription.
You know, I've seen firsthand what becomes possible when you stop chasing symptoms and start treating the root cause. You now have the complete clinical blueprint, from the muscles and bones to your metabolism. The only real question left is, are you ready to start fighting back against gravity? All right, now go check your posture.